the brain is most robust to brain injuries in the first and second decades of life. And injuries sustained during that period have typically the best outcomes and the best rates of recovery. And as we age, it becomes more and more difficult for the brain to recover after a traumatic brain injury. So older adults, especially over the age of 65, are at the highest risk for poor outcome after a concussion or a more severe traumatic brain injury.
From the USC Leonard Davis School of Gerontology, this is Lessons in Lifespan Health, a podcast about the science and scientists improving how we live and age. I'm Professor George Shannon, Kevin Shute Chair in Gerontology. On today's episode, how Professor Andrei Irimia is using advanced imaging and machine learning techniques to obtain unique insights into the adverse effects of brain injuries and the possibilities for staving them off. Andrei Irimia is an assistant professor of gerontology at the USC Leonard Davis School. He recently spoke to us about his explorations into the brain, including research around mapping brain connections and understanding the relationship between concussions and Alzheimer's disease. Hi, Andrei. It's a pleasure to be speaking with you today. To start with, why don't you tell us a little bit about the focus of your lab and your research?
Well, I am a neuroscientist and biogerontologist. I'm interested in the study of traumatic brain injury, particularly mild traumatic brain injuries, which are also known as concussions, and in the relationship between concussions and the risk for Alzheimer's disease. And I use magnetic resonance imaging, magnetic resonance spectroscopy, and related techniques for imaging the brain to study how concussion affects brain structure and function across the lifespan, particularly after age 65. And we also use electrophysiology techniques to understand brain activity and how it is modified by traumatic brain injuries and by Alzheimer's disease, by healthy aging, and by neurodegenerative disorders.
So traumatic brain injuries are a pretty big deal among older adults.
Yes. In fact, it is a little known fact about TBI that the age group where TBIs are most common consists of adults over the age of 65. So if one is over the age of 65, that's when the probability for a person to fall victim to a traumatic brain injury is highest. The second highest group consists of neonates, and then the third highest group is younger adults. And this has not been known for a very long time. And despite the fact that older adults are affected by TBI at the highest rate among all age groups, as I said, there's very little research that's been done on how TBI affects the aging brain. And so this is a major focus of my lab.
Coincidentally, I had a brain MRI about a month ago. Now, my wife encouraged my physician to recommend it because she was certain there's nothing left up there but sawdust. But I had this done, and they actually found brain tissue and very little wrong. But they did say something really interesting, and that is that they detected that years ago, I probably had a couple of incidents that resulted in concussions. And sure enough, they're right, because I was knocked out playing baseball when I was like 13 or 14. And then again, when I was playing football when I was about 20. The first time I woke up in the hospital about 2 hours later. And the second time I was out playing cornerback and my own linebacker hit me. And I was standing on the field with my helmet in my hand when they ran the next play. Fortunately, they ran it in the other direction. So I am familiar with this idea of traumatic brain injury, and it seems to have not affected me too greatly, but it's really amazing. How much of an issue are concussions or traumatic brain injuries in terms of Alzheimer's and other forms of cognitive decline?
Well, usually injuries sustained early in life are the least likely to cause issues down the road during the aging process. And in fact, the brain is most robust to brain injuries in the first and second decades of life. And injuries sustained during that period have typically the best outcomes and the best rates of recovery. And as we age, it becomes more and more difficult for the brain to recover after a traumatic brain injury. So older adults, especially over the age of 65, are at the highest risk for poor outcome after a concussion or a more severe traumatic brain injury. But during youth, especially, and in childhood, the risk is relatively milder than in older adults and than in middle-aged adults. And as you indicated, based on your MRIs, it's often the case that these incidental findings on MRI scans are identified in many patients in hospitals based on injuries that they sustained many decades ago. In most cases, these injuries do not have a very substantial effect on the aging process, especially if they were sustained during childhood or adolescence. After the age 40 or 45, there is a little bit of an increase in the risk for neurodegenerative disease, including Alzheimer's disease. And that risk really increases after age 65. We have a preliminary study where we found that the biological age of the brain increases dramatically after a traumatic brain injury sustained after the age of 65. For concussion sustained before that time, biological age of the brain does not increase substantially at all. And this is very interesting because it also affects the sexes differently. It appears that in males, there is a higher risk for sequelae down the road up to about age 65. But for persons who are injured after the age of 65, there's actually a greater risk for atrophy of the brain in females, which is interesting because, as you already know, the risk for Alzheimer's disease is higher in females. And also the onset of Alzheimer's disease is typically after the age of 60 or 65. So one thing that my lab is very interested in is how exactly sex interacts with hormonal changes, with the rates of biological brain aging, and with other factors in determining the risk for Alzheimer's disease. There have been studies indicating without a doubt that there is an increase in the risk for Alzheimer's disease after traumatic brain injuries, especially moderate to severe brain injuries. But there's also a substantial increase in the risk for Parkinson's disease and in brain cancer. And again, this risk becomes more substantial if the age at injury is older. So the older adults, again, are at the highest risk for all of these disorders to begin with, and concussions can dramatically alter and accelerate that rate of brain decline and may steer the brain onto a trajectory towards Alzheimer's with a far higher likelihood than one might otherwise expect in the absence of a history of TBI.
So these advances in brain imaging techniques that you've developed can help advance identification and treatment for people who have suffered brain injuries or who may be at risk for cognitive decline. Is that so?
Yes, we've done a number of studies that have been funded by the National Institutes of Health and the Department of Defense on how we might be able to predict the risk for cognitive decline after traumatic brain injury. And we have studied cohorts of patients with Alzheimer's disease and compared them to healthy control adults who are age and sex matched, who did not have a history of neurological disorders or of mental health disease. And we found that it is actually possible, using some tools that involve machine learning, to predict the rate of cognitive decline based on acute imaging findings shortly after the injury. And we were able, using these techniques, to determine that the fact that we can actually identify the patients who are most likely to be at the highest risk for accelerated cognitive impairment 6 months or even 1 year or further after injury based on imaging scans. So this I believe, is very valuable because it can identify patients who might benefit from additional monitoring and supervision by their clinicians and who might benefit from tailored therapies and from lifestyle changes that might decelerate the rate of cognitive impairment and might decrease the risk for Alzheimer's disease or other neurodegenerative diseases.
You speak of imaging and machine learning techniques. What exactly does that mean, machine learning techniques?
Well, machine learning is a class of algorithms, a class of computational methods that originated in the 1980s and 90s and really didn't become very widespread in the scientific world, especially in the biomedical field, until about 10 or 15 years ago. And since then, the field has become a major field of research. And machine learning is a set of algorithms and strategies for inference on a very broad array of scientific methods. They are based on statistical inferences, so they're based on classical statistics, but they use more sophisticated and advanced algorithms that allow us to identify and classify, for example, in our case, patients with TBI into different subgroups depending on their risk for different conditions like Alzheimer's. And the way machine learning accomplishes this is by taking the features of the brain that are input to machine learning algorithm and identifying very subtle and interesting features in those images that would otherwise be very difficult to identify even by experts. And machine learning algorithms use these features to classify and identify patients based on their risk. And usually this involves two steps. One is a training step where the algorithm is given a set of labeled patients based on their different risk, or for example, if you do classification, machine learning algorithm could do classification between healthy control brains and brains with Alzheimer's disease. And then once the algorithm has been trained to distinguish between the two, one can then input a testing set of data where the algorithm is asked to label those patients as being patients with TBI, Alzheimer's disease, or healthy controls. And this is sort of the general approach to machine learning, and there's a lot of different flavors. But the general idea is that you want to classify or solve a problem that is otherwise very difficult to solve using even expert insight. But with these algorithms that have really revolutionized biomedicine in a lot of ways, it's possible to accomplish some feats that were previously unattainable.
That's really amazing. I want to clarify for the listeners that TBI is traumatic brain injury. When we use acronyms, I always try to spell them out for everyone. You know, brain injuries are just one risk factor for cognitive decline, right? Our high-fat diets and sedentary lifestyles are others. Can you tell us about your research with the Tsimane people in Bolivia and what role this might play in helping to slow brain aging here in America?
Gladly. This is a very interesting and very important project that's been ongoing for essentially 20 years now, and I'm very fortunate to be part of a very large and talented group of interdisciplinary researchers who study the Tsimane people of the lowland Amazon basin in Bolivia. The Tsimane are a group of forager horticulturalists who live a very traditional lifestyle that does not rely on electricity or any of the amenities that we are used to in the industrialized world. They live in villages located in the forest of lowland areas in Bolivia, very far from electricity, from paved roads, from modern medicine. And the reason they are very interesting to study is because they have profile, especially pertaining to their cardiovascular health, to their neurological health, and to their inflammatory profile that is very similar to that of our ancestors many thousands of years ago. And there's a lot of interest in whether Alzheimer's disease, whether cardiovascular disease, and many other disorders are perhaps, at least in part, the result of modern industrialized environments where we have a large amount of processed foods being used, especially here in the United States, where we have air pollution, water pollution, where we have a lifestyle involving sedentarism, which is very common in the United States and elsewhere in industrialized countries. And by contrast, the Tsimane live a very active lifestyle, and they live off the land. So the men go hunting in the forest with bow and arrow. Their cooking does not involve trans fats or a lot of the unhealthy fats that are included in many of the processed foods here in the United States. So it's a very interesting natural experiment, so to say, because their example allows us to study how Alzheimer's disease and cardiovascular disease might be, in fact, predicated on some of the environmental factors that we have here in the United States and in other industrialized countries. And my part of this collaboration is focused again on the brain. And we had a study recently in the Journal of Gerontology where we showed that the brains of the Tsimane people, after adjusting for head size, have a rate of volume decrease, which is considerably slower than in populations from the United States and Europe. And we found this to be a significant result because the rate of brain atrophy is very highly correlated with the rate of cognitive decline and with the rate of Alzheimer's disease risk. And in addition to that, the Tsimane have a very low prevalence of cardiovascular disease. And in fact, a couple of years ago, our group published a paper in The Lancet showing that the Tsimane are the population at the lowest risk for cardiovascular disease out of all populations that have been studied by science. So this is a very unique group who seem to have excellent cardiovascular health. And now with our study on the brain, we have shown that they also have a very slow rate of brain atrophy, which raises the question as to whether our lifestyle here in the United States and in other countries that are industrialized, where we have unhealthy diets and a sedentary lifestyle, might actually increase the risk of Alzheimer's and the risk of cardiovascular disease to extents that are highly significant. So what's useful for us here in the United States, learning from the Tsimane, is that a lifestyle that is healthy in combination with ample amounts of exercise and low levels of stress are excellent and very highly conducive to low rates of heart disease, metabolic disease, and neurological disease. So it's very interesting also that the Tsimane have very high rates of inflammation because in the environment where they live, there are a lot of bacterial infections that affect them that go untreated because they do not have typically the access to modern medical care that we do. So their inflammatory biomarkers, their inflammation levels are very high, which is usually associated with more cardiovascular disease and a faster rate of brain atrophy. And yet, because of their diet and lifestyle, they have far lower risk of cardiovascular and neurological disease. And what that might mean is that these two factors, lifestyle, namely exercise and diet, play a strongly protective role against accelerated brain atrophy and heart disease.
That's really amazing. Out of curiosity, do they have a longer life expectancy than most of us here in America?
They do not. Currently, their life expectancy is changing because more and more of the Tsimane are interacting more frequently with an industrialized lifestyle. So there's more and more interactions. They're becoming more industrialized, so to speak. And currently their life expectancy is somewhere between 50 and 55 years. And usually the most typical cause of death is from respiratory infections, which are very common, as I said. They also have a large number of intestinal parasites because of their environment again, and due to their lack of access to modern healthcare. And so they do not have a very high life expectancy. However, there is a substantial number of Tsimane who live well into their 70s, 80s, and even 90s. And because we studied a very large cross-section from the Tsimane villages, we were able to enroll in our study a substantial number of individuals over the age of 50 and 60. And so that allowed us to draw the conclusions that we did, which is that the rates of brain volume decrease in the Tsimane are significantly lower than in the United States and in Europe.
Well, your research certainly covers many areas. What's on the horizon? What's next for you?
Well, we are currently extending our work with the Tsimane to cover, in a longitudinal setting, the brain atrophy trajectories that they experience. And we will be doing that with funding from the National Institute on Aging. We're also interested in the study of atrophy and the brain atrophy particularly, and its relationship with cardiovascular health, with brain atrophy and dementia. So the study that we've had so far has been a cross-sectional study. So we've only acquired data at one time point. Now we're going to be able to follow up on the participants that we studied in the first wave. And so we'll be able to study rates of change in a longitudinal design. And on the side of Alzheimer's disease and concussions, I'm interested in continuing our work on predicting Alzheimer's disease risk in older adults who suffer concussions based on metabolic parameters that can be obtained using a technique called positron emission tomography, which is used routinely for diagnosis of Alzheimer's disease. And I'm interested in whether concussions accelerate the ongoing processes that lead to Alzheimer's disease, even in the absence of concussions. But also I'm interested in whether concussions can trigger new or additional neurodegenerative processes that might increase Alzheimer's disease risk above and beyond natural processes that might be ongoing at the time of the concussion. So we're very excited about these directions, and we hope to continue our work and improve on our accuracy to identify these individuals who are at a higher risk for Alzheimer's after suffering concussions.
Well, your work is truly fascinating. As you know, my office is right next to yours. I think I should spend a little more time talking to you in the future. So anyway, is there anything else that you'd like to add?
So I'd like to encourage our listeners to check out our website. We have a lot of resources there about our research. We have some press releases by the university and by various national venues like the U.S. News and World Report that have featured our work and that describe our research in non-technical terms. We also have papers that we have published on all these topics. So there's information there both for scientists and for the general public on any of these topics. And thank you very much again for your interest in this work and for this opportunity to describe our research.
Well, thank you so much for speaking to us. This has been a truly informative conversation. Thank you.
Thank you.
That wraps up this lesson in lifespan health. Thanks to Professor Andrei Irimia for his time and expertise, and to all of you for choosing to listen. Join us next time for another lesson in lifespan health, and please subscribe to our podcast at lifespanhealth.usc Lessons in Lifespan Health is supported by the Ney Center for Healthspan Science and the Center for Lifespan Health.